What I like so much about this and the related studies is that they involve a lot of participants. So for instance, in this particular paper, which was published in BMC Medicine, they looked at a sample of 1,688 participants who had a mean age of 63, but there was a range of ages around 63, and of whom 51.4% were women, the rest were men. So it's a pretty nicely varied study in terms of the populations that they looked at. Basically what they found was the more often that people do sauna, the better their health is and the lower the likelihood they will die from some sort of cardiovascular event. Now, what do we mean by sauna? We need to define some of the parameters around sauna, and I promise to provide you some alternative ways to access some of the health benefits that were observed in this and related studies without the need to have a sauna, because I do realize that a lot of people don't have access to sauna. First off, the temperature ranges that were used in this study and pretty much all the studies that I'm going to talk about, unless I say otherwise, are between 80 degrees Celsius, meaning 176 degrees Fahrenheit, and 100 degrees Celsius, meaning 212 degrees Fahrenheit. So somewhere in that range. How hot should you make the sauna or the environment that you get into should you decide to use these tools? Well, that will depend on your tolerance for heat, how heat adapted you are.